Good morning.
Good morning.
Go ahead.
Good morning, Mr. Chair and members. Thank you for the opportunity to present SB 1142, a bill that will improve access to support services for people seeking reproductive health care information and services to abortion in California. First, I would like to thank the committee and the chair for working on the bill with my staff, and I'll be accepting the amendments that are detailed in the analysis.
Thank you.
Barriers to abortion still exist, even in California. People who seek health care services and choose to access an abortion do not do so lightly. The decision is one of the most difficult, complicated, and emotional decisions they can make. Additionally, the obstacles may be significant. The lack of resources to pay for transportation, lodging, wage support, sick leave, child care, or medical expenses are significant barriers. This year, the U.S. Supreme Court reviewed and as you know, a direct challenge to the landmark case of Roe v. Wade, and they overruled it. This was obviously written before, but they did overrule it. Long-standing legal protections of abortion services and this new tremendously distressful decision has caused 26 states to ban abortion, impacting as many as 36 million women and people who may become pregnant. According to a recent Guttmacher Institute report, California may see a near 3,000% increase in people driving to California for abortion care if a total ban were to take place in the United States. If this is the case, patients will need support. They may need to access transportation, lodging, and childcare, and abortion providers can expect to see a rise in demand and in overall workload. SB 1142 will improve access to direct and practical support for abortion patients by providing grants to California-based organizations who provide these services to patients. Direct support, such as a ride to a health care facility, is sometimes the difference between receiving care and not. For decades, abortion funds like Access Reproductive Justice independently fundraise to directly and indirectly support callers and patients with these needs. Some abortion clinics also assist their patients with practical support. The unmet need, however, is far greater than the resources currently available. SB 1142 will create a website with centralized information for people seeking care in California. This will combat misinformation and provide patients access to the opportunities available to help them access abortion care. The site will include comprehensive and medically accurate information about abortion providers, procedural support options, information on the types of services available, and insurance information, along with language support services. The states of Washington and New York already have created landing pages that are similar to direct individuals to links for abortion care, post-operation resources, abortion funds, and assistance. The goal is to strengthen practical support infrastructure by providing one point of entry to connect a patient with the nearest or most accessible abortion provider, obtain health coverage or financial support for the care, and assistance for logical needs. As a reproductive freedom state, California must be prepared to treat patients who are seeking care in the state and navigate them to the best care possible. SB 1142 is just one of the many steps the state can take to help achieve the goal. My co-author, Senator Nancy Skinner, has been with me throughout the entire time and would be here today but couldn't make it. So with me today to testify is Molly Robeson, Legislative Director of Planned Parenthood Affiliates of California.
Thank you. First witness, please.
Good morning, Chair and members. Molly Robeson, Legislative Director with Planned Parenthood Affiliates of California. We represent the 7 affiliates in the state who operate over 100 health centers in California. We're here as a co-sponsor of SB 1142. As the Senator mentioned, there's many barriers that people face when they're accessing abortion, and these barriers are not new, but they are compounded by the fact that Roe v. Wade was overturned last week, making abortion illegal and inaccessible in 12 states already, and it's expected to be a total ban in 26 states across the country. To address these barriers, providers like Planned Parenthood provide support to patients that is beyond just medical care and help with logistical barriers and financial assistance. With Roe being overturned, it is expected that California will see 6 times as many out-of-state patients traveling here for abortion care. And Planned Parenthood health centers have already seen this increase. Since last September, when SB 8 went into effect in Texas, we've been seeing on average 1,500 out-of-state patients each month at our health centers. People need support now more than ever, and California is able to provide that support. SB 1142 will ensure that Planned Parenthood health centers and our partners on this bill, Access Reproductive Justice, can continue to meet the needs of patients in California and alleviate constraints imposed on patients. In order to remain true to California being a reproductive freedom state, I respectfully ask for your aye vote on this bill today.
Thank you. Anyone else in the hearing room in support? SB 1142.
Cindy Hillary on behalf of the California Medical Association in support.
Erin Evans on behalf of NARAL Pro-Choice California, a proud co-sponsor of this measure, as well as the California Nurse Midwives Association in support. Thank you.
Thank you. Anyone else? All right, seeing none, operator, would you open the lines for anyone who would like to indicate support for SB 1142? We will not take further testimony at this point, but name, affiliation, and support.
Thank you, Mr. Chair. If you are in support of SB 1142, please press 10 at this time. Put yourself in queue, and we will go to line 41. You are open.
Thank you, Mr. Chair. Ryan Spencer on behalf of the American College of OBGYNs, District 9, in support.
Line 68, please go ahead.
Mr. Chair and members, Curtis Lang with the California Nurses Association in support. Thank you.
Line 82, your line is open.
Good morning, Chair members. Priscilla Quiros on behalf of the City of Los Angeles in support. Thank you.
83, please go ahead.
Good morning, Chair and members. Gregory Kramer on behalf of Disability Rights California in support.
And if there's additional people that would like to testify in support of SB 1142, go ahead and at 10. Line 87, you are open.
Good morning. Rebecca Gonzalez with the National Association of Social Workers, California chapter in strong support.
Mr. Chair, we have exhausted the queue.
All right, thank you. We will move to opposition. I have one opposition witness listed on the telephone. We also have one. Oh, come forward, please, then. Susan Arnall.
Thank you, Chair and members. My name is Susan Swift Arnall. I'm an attorney with the Right to Life League, America's first pro-life organization. You already are well aware that SB 1142 violates our California Constitution because it is one-sided in its funding, making no funding accommodation for childbirth services as required under our state Supreme Court ruling in Committee to Defend Reproductive Rights versus Myers. That was decided in 1981. The word abortion appears more than 60 times in this bill. The word childbirth does not appear at all, not even once. All the grants this bill envisions are for abortions only, not prenatal care, not maternal care, not childbirth, just abortions. SB 1142 may create a huge national abortion trafficking system open to widespread abuse and fraud across state lines. For example, how will verification of eligibility to travel here be determined? Only pregnant people who wish to abort are eligible to travel here under these funds. Who is to confirm the pregnancy before the patient arrives in California for their free abortion? What ramifications will California face for enticing underage girls here from other states to perform procedures that may be illegal in those other states? Will SB 1142 traffic underage minors to California without parents' knowledge for abortion procedures? Will abusers and sex traffickers transport underage girls here to procure secret abortions on the taxpayers' dime? And what if women who come here change their minds and want to keep their baby? Will taxpayers simply absorb the cost? Or will we tell those women that the state programs won't pay for their expenses, a form of financial coercion, forcing women to close their eyes and spread their legs in stirrups to avoid the costs of travel, lodging, lost wages, sick pay, and child care, which the state's going to advance? This ill-advised program to favor one reproductive choice over another was unconstitutional in 1981 and remains unconstitutional today for very good reasons. I recommend a no vote on SB 1142. Thank you.
Thank you. Anyone else in the hearing room who would like to indicate opposition to SB 1142? Seeing none, operator, would you open the lines for opposition to SB 1142? Then again, we will take name, affiliation, and opposition. No further testimony.
Thank you, Mr. Chair. As he stated, if you are in opposition to SB 1142, please press 1 followed by 0. And again, to express opposition to SB 1142, please press 1 followed by 0. We do have one that's getting their line number. One moment, please. We're going to go to line 88. You are open. 88, please go ahead. Your line is open.
Thank you, Mr. Chair and members. On behalf of Rock Harbor Church Bakersfield, Calvary Chapel, Visalia, Exeter, Porterville, Tulare County Coalitions for Freedom and Constitutional Rights for the Unborn Victims, we respectfully oppose this bill. Thank you, Chair.
Nobody else did queue up, Mr. Chair.
All right, thank you, operator. You may close the line, so I'll bring it back to the committee. Questions, comments? Mr. Haney.
I want to thank the author for your leadership. This makes me proud to be in California, where we are stepping up, not only for people in our state, but around the country who are going to have, in an unprecedented way, their health under attack, their lives under attack. And this will allow them not only for us to say that we're providing it, but actually a true mechanism for them to be able to access the information. You know, the point about people making decisions for what is best for their health, this is what will help them do that. This is the information that they can then review, that they can also review with their doctors, with their families, to make the best decision for themselves. And that's what we want for everyone. And so for us to be able to do that for people here and across the country and put dollars behind it and our own, our what we have access to here, I think is extraordinary. So thank you for doing this, particularly in light of, I think, for all of our constituents, the just incredible distress and anxiety and concern and frustration and fear. This is a real response. And I hope that the federal government also does similar things with everything that they have under their authority. So thank you, and I'll be very proud to support this today. Thank you.
Thank you. Other questions, comments? All right, seeing none, thank you, Senator, for bringing this forward. It is interesting, opposition to these measures just continue to be hyperbole and obfuscation. So this bill should survive this committee, and you may close.
Thank you very much, Mr. Chair. I really appreciate the comments, and I think it doesn't need to be said, but this really has to do with whether the government should be intruding on personal private medical decisions and the availability of health care. I feel very strongly about that, and using words like enticing and trafficking and coercive procedures just really, as you said, it obfuscates the issue, and so I respectfully ask for your aye vote.
Thank you, Senator. We will take this up once we have a quorum.